This is a 215 Social Security Medicare guide. The numbers you need to know before you roll your dice and make decisions that can affect the rest of your life. Make sure to go through this slowly, absorb the numbers, write down what you need to know. We are also including on our website, insuredmeds.com, a PDF file that you could download and have a record for your files. Here is determining your full Social Security retirement age. What it's saying is if you were born, let's say, in 1958 and you started taking Social Security at 62, you reduce your lifetime income by 29.17% if you take that income before 66 and 10 months. Now, it depends on your family history and it depends on your health. If you have a history, a family history of people dying early, then you're better off taking it early. If you have a history of longevity in your family, you're better off waiting. Now, the thing to consider is that if you're still working until Social Security, you're better off waiting. Because if you start taking it at 62 and you continue to work, you lose $1 for every $2 that you earn. So if you have longevity in your family and you're still working, you're better off waiting. The other factor is that the longer you wait to start getting Social Security, the better for your spouse. If something were to happen to you, she takes your full Social Security amount. Social Security cost of living adjustment, what they call COLA. This shows you what the increase has been over the years. As you can see, in 1998 it was 1.3% increase, and in 2015 it was 1.7. But there were times when the inflation was up, like in 2008 it went up 5.8%. This is one of the major benefits of Social Security, and another reason why the longer you can wait, the better, because that percentage is a percentage of your monthly payment. Social Security FICA payroll taxes. It is up to $118,500 for Social Security to get taken from your pay. The You get 6.2 Social Security rate. Medicare rate is 1.5. Single head of household is 200,000. Married filing joint is 250,000. Married filing seven is 125,000. So as you can see, that the more you make, the higher the tax. But once you pass 118,500, then you don't pay any more Social Security tax. So I wish I had that problem to be making over the 118,500, so I wouldn't have to pay Social Security tax anymore. And bear in mind that even when you pass 66 and are getting Social Security and have income, you still have to pay taxes. Sorry. Social Security benefits, the maximum Social Security pays out to anybody is 26,663. Earnings and limitation benefits before the FRA $1 for $2 benefit reduction. You could earn up to $15,720 a year up until the first month you turn full retirement age, or the FRA, $1 for three benefit reduction, or $41,880 a year. After full Social Security retirement age, no deduction, no reduction. So that's an important thing, as I said in the last slide. Social Security benefits taxation, income in retirement causing 0 up to 50% or up to 85% of Social Security benefits to be taxable. I know, we all say, I already pay taxes. Why pay taxes on my Social Security income? Unfortunately, that's the rule. So, single or head of household up to 50% of taxable income above 25,000, up to 85% taxable above 34,000. Married filing jointly up to 50% taxable of 32,000 and up to 85% taxable if your income is more than 44,000. The primary insurance amount, the PIAA calculation. Average index monthly earnings 0 to 828, 826 is 90%. 826 to 4980 is 743.40 plus 32% of the excess of 826. 4980 is 2076.68 plus 15% of the excess over the 498. Medicare Part B monthly premium. This is a very important thing. A lot of people don't realize that if your income for single is 85,000 or more, or married is 170,000 or more, you don't pay the regular 104.90 for Part B of Social Security. It starts at 85 to 107 for single and 170 to 219. You pay 146.90. As you can see the numbers, above 214,000, you pay in single, and 428 for a married couple. You could pay as much as 335.70 a month. Again, we should all have such a problem to make that kind of money that we have to pay more for Part B. If you're married or filing a separate return, then basically it's half of what those numbers are. Now here's a chart that you should take the time and slow the video, pause the video, and look through the chart of Part A and Part B and Part D. A lot of people don't understand these facets of the Medicare. You know, everybody has to get Medicare at age 65. If you are working, you can delay taking Part B because as long as you're covered, you don't have to participate in Part B. Now, bear in mind that Part A is free. But once you stop working or retire fully and you're 65, you must get Part B. If you don't get Part B when you're entitled to get it, you will have a penalty for the rest of your life when you start to take it. Part D also has a penalty if you don't take it when you're supposed to take it. So here, Part A hospital, Part A monthly premium is 0 for you and spouse if you pay Medicare taxes while working, up to 407 for you and up to 407 for your spouse if you did not pay Medicare taxes while working. So the first 60 days, these are the coverages. The first 60 days has a $1,260 patient deductible. The next 60 days is $630. This is a lifetime reserve days. Patients pays per day. Next 30 days is $315. Patient pays per day. So you can see it's not free. And this is why you need a Medicare supplement or HMO to cover these costs. The Part A skilled nursing benefits, as you can see, the first 20 days, you don't pay anything. Over 100 days, all costs, patient pays all costs. So for the first 20 days, you don't pay anything. The next 80 days, you pay $157.50 per day. Over 100 days, all costs, you pay everything. So Part B, the monthly premium is $104.90 minimum with a $147 deductible and co-insurance of 20%. I was with a client today and I had to explain that yes, you pay $104 minimum for the Part B, but you do have to reach a $147 deductible in Part B. And then after you get the deductible, you have to pay 20% co-insurance. So Medicare covers 80%, you pay the other 20%. In Part D prescription benefits, note some Medicare prescription drug plans have different levels or tiers of copayment with different costs for different types of drugs. Average monthly premium is $32 projected. Deductible is $320. Initial benefit limit is $29.60. Catastrophic coverage starts at $4,700 out of pocket. Beneficiary with high income pays a Part D premium adjustment to Medicare. This is a chart I'm not going to go into reading it, but pause the video and you can see the different strategies for Social Security strategies: withdrawal application, payback, suspension of benefits, file and suspend, enabling spouse benefits. So there's a lot of strategies that you can use to qualify and get better rates on your Social Security. But you can see other considerations. So take your time and go through this and get a good reading, because it could save you quite a bit of money and put a lot more money in your pocket over time. As always, we are available to give you information. Let me just give you a little legalese. This document is designed to provide general information on the subject covered. Please note that InsuredMeds.com representative employees do not give legal or tax advice. For more information, please visit your local tax advisor, attorney, Social Security Administration office, or Centers for Medicare and Medicaid Services for your particular situation. Again, you should have taken your time. We do have this available on our website as a downloadable PDF. Any concerns or anything that you need, reach us at insuredmeds@gmail.com, or send a response on our website, insuredmeds.com. See you on the next video. Wishing you the best. Please share this video with everyone on your email list. Don't keep us a secret.